starts, I'll put it in the chat. It's also in the show notes. You like your link tree to be in the show notes, right?
That'd be great.
Yeah, because then that's everything at once. Well, here we go. Hey, everybody, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Today's guest, backed by popular demand, is Dr. Saray Stancic. And Stancic, I just went over that with her and I still blew it. Oh,
okay,
anyway,
it's not easy.
I got the first name right. I get a little nervous sometimes interviewing doctors, but anyway, she's been on before talking about her wonderful documentary Code Blue. If you haven't seen it, check the link in the show notes. You've got to see that. But now she has a brand new book out. I'm going to put a link to where you can get it on Amazon. It's called What's Missing from Medicine, and we're going to find out today what's missing from medicine. And welcome, by the way.
Oh my goodness, thank you so much for having me. It's such a joy to join you again. Last time we talked about Code Blue, and I saw that you interviewed Dr. Trilk and Chef Scott, and so you were able to talk a little bit about how important it is to get nutrition in medical schools. I was thrilled to see that interview. But I'm so excited to be with you today to talk about what's missing from medicine. The book was born yesterday, launched yesterday. I call this my gestation period, you know, the whole period of writing the book and then promoting the book. And finally, its delivery date arrived January 12th. And it was just such a joyful day for me yesterday. I have to tell you, just all the love and support that I've received from family and friends has been extraordinary. I heard from a veteran that I cared for 20 years ago at the VA hospital in New York yesterday, celebrating the book. And I've had photos sent to me from individuals I went to high school with in their homes with a photo holding the book. And it's just been so much joy and so much love. And I feel so blessed today.
You know, I wish you every success with the book. And I thank you for the documentary, because that is how I found out about Dr. Trilk. And there was an amazing guest. She's amazing. And so you're really bringing this message to so many people. It's so exciting having your first book. It's sort of like having your first kid, isn't it?
It is. It really is. And, you know, the title of the book, some people ask me, well, what's missing from medicine? And of course, those very important variables that we talk about within the context of lifestyle medicine, of course, I'm referring to, and I use the analogy, AJ, of a wheel, and the lifestyle medicine wheel, and then there's these spokes on that wheel, and those spokes are those 6 important aspects of lifestyle, which of course are nutrition, exercise, stress, sleep, the importance of addressing substance abuse issues, and then finally, and also importantly, is the importance of connectedness, our relationships in our lives and how important they are in terms of our health outcomes. So what's missing from medicine is this very topic, right? This is what you discussed with Dr. Trilk, and why the work that she's doing at the University of South Carolina is so important, because it is a medical school that is built on the foundation of lifestyle medicine. So and I know that you also had a medical student that you interviewed that was able to offer her perspective, and how wonderful to, of course, clinical medicine as we know it, all the aspects of procedures and pharmaceuticals and surgical interventions are incredibly important and should be part of how we train physicians. But the regret is that we're not emphasizing the importance of prevention, the importance of lifestyle, and the influence that it has on health outcomes. We know that genes play a role, but lifestyle matters most. And the wonderful thing is that each and every one of us is in control and can make these decisions each day that favor positive outcomes. And that's really my hope for everyone, is that we can all employ these, you know, very simple measures. Because the other wonderful thing about lifestyle medicine and all the aspects that I discuss in the book is that it's really not all that complicated. It's pretty simple, but yet so powerful. Sometimes we think the solution to the problem has to be so complex, and it's really not. We know that by optimizing our lifestyle choices, we can prevent 80% of chronic disease, and that is incredible and so powerful. And so that's really the message of the book is joy and offering each and every individual who reads it the tools that they need to optimize their outcomes.
So why isn't this taught in most medical schools?
Yeah, that is a great question. And I'm sure you've had that conversation with Dr. Trilk. There's been quite a delay. Prevention is something that is not truly emphasized in medical school. I think the good news, though, AJ, is that there is a movement favoring an introduction of lifestyle medicine into the foundation of all medical schools. And I think it is spreading across the country. I know there's a lot of interest. I've had communication from many deans of medical schools across the country who have heard about Code Blue. And the discipline of lifestyle medicine is becoming more and more well recognized by not only the community, but also physicians are becoming much more aware. The American College of Lifestyle Medicine is growing by leaps and bounds. It's an organization that I remember the first time I attended a meeting, there might have been 100 physicians in the room. That was about 10 years ago. And today, we're surpassing 3,000 physicians at these conferences. So certainly lifestyle medicine and prevention is becoming more and more mainstream and more popular. And again, it doesn't mean that we abandon all the advances we have in convention. I mean, I think it's extraordinary the accomplishments that we've achieved. If we just for a moment think about current day, the issues that we're dealing with today, the COVID-19 pandemic, and the fact that we have today 2 vaccines that have been approved for COVID-19 in less than a year, I think that speaks to what we can accomplish in the field of medicine. So the idea of bringing mainstream medicine together with these principles of prevention, I think is very, very powerful and can certainly do much to address the chronic disease epidemic that we're currently facing.
Isn't the whole the healthcare system set up wrong? I mean, it's really not a healthcare system, it's a sick care system.
It sure is, yeah. And again, we are, as you know, living in the midst of this chronic disease epidemic. We have 70% of Americans that are either overweight or obese. Heart disease remains the #1 cause of death in our country. More than 600,000 Americans die each year from heart disease. Cancer is second. So we are, the healthcare system is really about treating and managing all of those chronic diseases, and there's little time, effort, or money employed to address the preventive wing of all of this. And I think that, when I went to medical school 25 years ago, the notion that diabetes was something that could be prevented or reversed was completely foreign, or the notion that that heart disease was something that was largely preventable. I mean, that's something that is really quite shocking in retrospect. This wasn't something that I learned in medical school. It was something that the literature has come to describe in most recent years. But I think that this whole idea of preventive medicine is gaining a lot of attention, and we're certainly moving in that direction. But yeah, I mean, right now the healthcare system is devoted to managing all the trouble we've gotten ourselves into, and that's part of what I discussed in the first chapter of the book. Is how did we get to where we are today? And it's largely the standard American diet on which we're fueling. We've become a very sedentary population. We're highly stressed. Even think about in the current day, again, the pandemic, how are we managing our stress? Some of us are drinking too much. Some of us are eating too much. We're engaging in behaviors that are detrimental to our health. So I think we need to learn that we need to connect those dots, that the heart attack that happens at age 58 begins with bad choices in your 20s. And the wonderful thing is that there's more understanding of these connections, whereas before, I think in the past, we placed a lot of emphasis on our genes. And even I can recall in medical school, a lot of heart disease and diabetes was largely attributed to genetic predispositions. And we now know that there's so much we can do in regards to our daily choices. We know this science of epigenetics tells us that Our behaviors are incredibly important in regards to what genes we turn on or off. So just because we have a genetic predisposition, let's say to heart disease or to breast cancer or to diabetes, that not necessarily will those genes be turned on and that disease will manifest in that individual. That so much of the decisions we make every day play a key and important role in whether or not those genes get turned on. So again, putting more power in the individual's hands, which I think is really exciting.
Well, I almost don't want to bring this up, but do you think the fact that lifestyle medicine isn't more popular is because there's really not a lot of money in broccoli, but there's sure a lot in pills and procedures?
I think that's one of the obstacles that we have in lifestyle medicine. You're right. This is not a moneymaker. And because the way our healthcare system is set up and the way third-party payers are set up, where the value lies in the procedure, or right. So the cardiologist who's placing stents every day is going to be greatly reimbursed compared to the lifestyle medicine physician who is counseling and supporting behavior modification. So what we value as a society and what our healthcare system values is in large part upside down. So we need to these are all discussions and again, turning to Dr. Truk, a lot of her work has been focused on policy and I'm sure she talked to you a little bit about that. We need to sort of redefine not only our healthcare system, but how we value it, and that's the third-party payers.
It's interesting. I was listening to you on a podcast, and you mentioned as you were working on your book, you had to actually change the obesity statistics because they went up something like 3% within a very short time.
They did within a year, which is amazing. Yeah, I mean, I had turned in the final version of the book, and we went through one last round of editing, and I'm checking my facts, AJ, and I go to this, the CDC obesity rate just to check the facts, and it was 2.6% higher than the year before, which really speaks to, again, that sense of like, there's no plateau here. This issue that we're dealing with, this chronic disease environment, this epidemic has not yet plateaued. We're seeing worse and worse outcomes. And again, obesity is a great example that illustrates that. In 1 year, a 2.6% increase. And then diabetes is another really good example where we're seeing every year increased rates in diabetes. When I was in medical school, rates of diabetes in our country were about 2%. Today, we're brushing past 10%. And the CDC predicts that by 2050, that's around the time my son is my age, that about 30% of Americans, AJ, will be diabetic. And we can't, as a society, afford that. I mean, and just think of all the premature loss and pain and suffering that accompanies that number. So there's a lot in medicine that we're doing that is incredibly important and valuable, but developing yet another drug to treat diabetes. We know that diabetes is largely preventable by modifying our behaviors. Of course, I'm talking about type 2 diabetes mellitus, and we need our healthcare professionals across the board to speak to this ubiquitously and unanimously. This is a message that needs to be relayed to all patients across our country and beyond. And so also in writing this book, for me, it was also a handbook, not only for the individual who wants to introduce improved behaviors in their own lives, but also for the medical student or the healthcare professional who isn't getting this in medical school, that this could accompany their experience and their education. It is a book that is based on evidence. It's evidence-based. I made an effort to assure that everything that I speak to is supported by substantive evidence-based peer-reviewed medical literature. I think that's incredibly important. So that this is not, by the way, alternative, holistic, what I'm suggesting here. I'm not saying that we abandon, again, I think it's important that the message is understood, that I'm not saying that we abandon medication or that there's no role for mainstream conventional peer-reviewed approaches, but the fact that we know 80% of the chronic diseases that we see today are preventable. We need to start there. Isn't that an important starting point? We're still going to see heart disease and autoimmune disease and cancer, but we can largely and drastically reduce those numbers by modifying our behaviors.
Wow. So here's an interesting question from Maureen, who's watching live. Is lifestyle medicine always vegan?
Great question. And no, not necessarily. So lifestyle medicine and what I read in the book, what I describe is really a plant-centered or plant-based diet, which can have some animal components in it. I personally don't consume any animal foods in my own diet, but the great weight of evidence that we have in the literature, for example, the Diabetes Prevention Program, which was a study that was published in the New England Journal of Medicine in 2002, which clearly showed that diet and exercise was more effective in preventing diabetes versus metformin, which is a drug that we routinely use in diabetes. In that study, it was not a strictly vegan or strictly plant-based diet. So do I believe that possibly if we had an arm that was strictly plant-based, that we might see better outcomes? Possibly, but that has not yet been tested. So really the message that I relay in regards to dietary choice in the book is that we really need to increase the amount of plant-based foods in our diet. Currently, as you know, in the standard American diet, it only accounts for probably less than 10% of our calories. So we really need to increase the amount of plants in our diet for so many reasons. Obviously, they're a great source of fiber, which serves to improve our microbiome. They're a great source of phytonutrients and antioxidants that are incredibly important in maintaining cellular health. So plants and whole foods, foods that are most in their natural state, are what we know offers us the greatest health benefits.
Great. You mentioned the six spokes in the wheel. You said nutrition, exercise, stress, sleep, substance abuse, and connection. And I've only heard of 5 spokes before. I've never heard substance abuse being in there.
Well, substance abuse is a very important issue to address. Obviously, smoking is one of the leading causes of premature death in our country. And the good news is that we've done so much good work in addressing tobacco cessation over the past 30 to 40 years. And as you know, in the 1960s, the Surgeon General produced the first Surgeon General's report that clearly documented how detrimental smoking was to our overall health and well-being, contributing not only to cancer and heart disease, but COPD, chronic lung disease. And regrettably, it took so long, AJ. Do you know that it took until 1993 to remove smoking from hospitals? It took that long. It's been a difficult climb, but we've gone from near 40+% of Americans smoking to, we're down to about 13.7%, which is great, but we're still 13.7% too high. So that's, so lifestyle medicine is about addressing tobacco use for sure. Alcohol is a very important variable. And I think there's a distinction here because alcohol is largely in society very acceptable. It's what we do when we gather. We go to a game and we have a beer, or we have a celebratory dinner and we drink. And alcohol can be very detrimental. There's really no safe amount of alcohol in our diet. So we want to be very aware and mindful of how much alcohol we're consuming. Most recent guidelines recommend 1 alcoholic drink per day for women and 2 for men. As you know, the most recent nutrition food guidelines, there was a recommendation by a scientific committee to reduce the 2-drink cap for men down to 1, and there was some resistance there. So it's currently the most recent dietary guidelines have remained as they were in 2015, which I think is regrettable. I think the overall message, though, is that we need, as individuals, to be very honest about and take a moment to consider how much alcohol we're consuming and how we can, be a bit more mindful and maybe reduce how much we're consuming. And then, of course, there are other substances that can be, obviously, drugs can be a problem. So these are all issues that need to be discussed, and lifestyle medicine physicians are trained in supporting patients in those behavior modifications to reduce dependency on substances.
Well, nobody needs to smoke and nobody needs to drink.
Yeah.
But what about food? Because do you think that for some people that also is substance abuse?
Absolutely, that can be potentially another addiction, and and it's a challenging topic, AJ, food addiction, but it's certainly something that is prevalent in our country, and a large part of that is that's fueling that is the production of these hyper palatable foods, right? These foods that are coming out of factories, not out of farms, and they're layered with sugar, salt, and fat. And the chemistry of that results in very much an addiction. So bringing awareness to the individual patient and helping them to understand, when you're consuming these foods that are coming from these large, food corporations, where these foods are produced in the lab, and they're produced to keep you addicted, to keep you coming back. And so we need to convey those messages to patients so that they understand that these foods are not serving them and certainly contributing to many of their healthcare outcomes, including accumulation of excess weight. And I just want to say, regarding overweight and obesity, I mentioned earlier that 70% of Americans fall into those categories, and this is alarming. And it's not the cosmesis of excess weight because I think that's so much of what we've been fixed on. Excess weight isn't just a cosmetic issue. It is producing these pro-inflammatory cytokines that then fuel chronic diseases. So for women let me make this point, when you're carrying excess weight, you're increasing your risk of developing breast cancer. For men, you're increasing your risk of developing prostate cancer. You're increasing, for everyone, you're increasing your risk of developing diabetes. So I know that the topic of obesity is a challenging one, and we certainly don't want anything that's regarding shaming, but we have to be honest about where we are with this topic, and it needs to be addressed.
Yeah, I mean, some of the doctors I interview just say that, like, it's gotten so that the doctor doesn't even address the weight of the patients because it's gotten so touchy. Yet,
So touchy, it's so sensitive, and that's exactly what happens, AJ. And I've had so many patients when I see them on that first visit, and we talk about their BMI, and we talk about excess weight, and explain to them that they do fall into this category of obesity, and what that means, and what that increased waist circumference puts you at risk of cardiovascular endpoints. And they say to me, Dr. Stancic, my doctor's never told me, they've never used that word obese. They've never suggested that I was overweight. And some of them are very surprised to hear it. And I think it's in large part because we feel so uncomfortable as physicians and healthcare professionals discussing the topic. And that needs to end, because it is so important that we convey these messages, because we need to support our patients in understanding the risks that are involved.
like, that's why I host the Truth About Weight Loss Summit now in its third year, because, we don't want to shame or blame people or make them feel bad for being overweight or obese, but this health at every size movement, I think that could be detrimental to a lot of people whose, like you said, obesity is an inflammatory disease, and so are the diseases they're getting as a result. And people need to at least be told that there's a connection.
Exactly. Yeah. And that's what it is. It's about being transparent and having a relationship of trust with your patient. It's not about shaming, and it's not about blaming. It's about educating and supporting and helping the individual understand these connections. Obesity is an inflammatory, a process that leads to pro-inflammatory cytokines that fuel these diseases that are leading to our premature death, so much pain and suffering. And so I think it's critically important that we speak truthfully, honestly, and very respectfully.
So people are asking if you could explain a little bit more what are cytokines?
Cytokines are molecules, chemicals that are released from the cell that trigger this inflammatory process. And we know, and there are cytokines that are positive, that have positive influences, and there are cytokines that have negative influences. And when we have when we carry excess weight, we're producing these negative cytokines that then serve to promote and turn on those bad genes and promote the nidus or the beginnings of the disease process.
Great, thank you. So there's a question if lifestyle medicine can help with rheumatoid arthritis.
Yes. Well, lifestyle medicine, let me just say this, can help with everything. So rheumatoid arthritis is another example of an autoimmune disease. And so autoimmune diseases are diseases where your immune system, which is supposed to be, what protects you from foreign invaders. So a good immune system is supposed to fight off a bacteria or virus that comes into your environment, or even a precancerous cell. So our immune system is constantly watching over us, and if we come into contact with anything that is foreign or problematic, its job is to destroy it. But within an autoimmune disease, it gets confused and it targets something in us. So in rheumatoid arthritis, it's the lining of the joint. So it attacks that, and so we get damage to the joint and inflammation, and patients develop rheumatoid arthritis. Similarly, in my case, multiple sclerosis, it's an autoimmune disease, but this time, instead of attacking the lining of the joint, you're attacking myelin, which is that fatty sheath that protects the brain and spinal cord. And there are many autoimmune diseases. The list continues to grow. I think last time I checked, there were more than 50. And again, the mechanism is the same. It's your immune system attacking some endpoint, some body system in the individual, but it can vary in all of these different types of autoimmune diseases. And absolutely, when we engage in optimal lifestyle, an optimal diet, exercise, sleep, we create an anti-inflammatory environment. So we're cooling off those pro-inflammatory cytokines. And so individuals living with autoimmune diseases like rheumatoid arthritis will have improvement in symptomatology, and hopefully and by the way, it's important to note that maybe some folks may want to change their behaviors or employ the principles of lifestyle medicine in their personal health, because they were maybe diagnosed with rheumatoid arthritis or lupus or MS. But the good news is that when you introduce these changes into your life, it's not only serving the betterment of your rheumatoid arthritis, but it's also going to reduce your risk of colon cancer. It's going to reduce your risk of heart disease, of diabetes, of Alzheimer's disease. That's the wonderful thing about this prescription, AJ, is that it's all encompassing and it serves us on so many levels. It's going to increase rather decrease our anxiety or our risk of depression. Our joy meter is going to come off it's going to jump off the meter there, and there's fatigue dissipates, your energy levels rise. I mean, it's just incredibly powerful and in many ways infectious.
Great, thanks. So there, a couple of people are asking for clarification on the alcohol. You're not saying that people should drink 1 drink a day, but that should be the limit. So Sharon wanted to know, how do you feel about moderate drinking of 1 drink a day?
Yeah. So the standard, the guidelines for men is 2 drinks max per day, and for women 1. Now, that's not to say the recommendation is that you should have a drink a day. That should be the maximum. In fact, I think you shouldn't drink at all, ideally. I personally will have a glass of wine on occasion to celebrate, but it's not something, I think at some point, some people thought that drinking a glass of wine because of the antioxidants in wine could be beneficial, and it should be something that should be added to your daily practice. And that I would not recommend. Alcohol is a carcinogen, and no amount of alcohol is 100% safe. So I would advise that if you're going to drink, that you drink certainly in compliant with the regulations, the standards by the guidelines. But I certainly, you could be just fine not drinking at all.
Yeah. Thank you. Thank you. Sarah says, what are your thoughts on ADHD medication?
Well, you know, I'm not an expert in that field. I think that medication, just an overall rule, there is a role for medication and in individual cases. I think that certainly whenever possible, and this is always my approach, if I have a hypertensive patient, I want to do everything I can to optimize their lifestyle so that we can reduce their blood pressure through lifestyle. But that doesn't mean that I'm not going to use medication. So I think that, again, in the individual that might need that medication to manage their ADHD, it is going to, I may use medication to support them, but I'm also going to help them to optimize every aspect of that lifestyle, each and every one of those spokes on that lifestyle medicine wheel that I described initially. And remember, it's so important that we address all 6 spokes, that it isn't just because some of us are so good at food and some of us are so good at exercise, but if you're really good with your food and really great with your exercise, and then you're drinking 3 drinks every night and you're not sleeping, then you're compromising your overall health and well-being. So it's really important, and they all intersect. They're all dependent in large part. They may be dependent on one another. For example, if you exercise really well, you're probably going to sleep much better. When you exercise, you're also more likely to make better dietary choices. So again, the wheel, I love the analogy of the wheel because you see that that they're sort of dependent on one another. And if you had a wheel and 2 of your spokes were sort of weak and wonky, you can imagine that your forward movement wouldn't be very effective. And that's what we want. And it's what I describe in the book as the sweet spot. When we can optimize every aspect, each and every one of those spokes on that lifestyle medicine wheel, that's what I call the sweet spot. That's where we're going to gain the greatest benefit, reduce our likelihood of developing a chronic disease, age gracefully. And that's the goal here, right? I mean, at some point, we're all going to pass away. But the idea is to age gracefully and have good quality of life to the last day on earth. My hope, and I say this all the time, is that each and every one of us on that very last day, that we enjoy a beautiful day with family and friends. And that night we go to bed and we peacefully pass on. And that is, and I think we can do that, AJ. We can largely do that, but it's imperative that we convey these messages to our community, because currently where we are today, we are largely a society that is consuming a horrific diet, the standard American diet, which is largely processed foods and animal sources, very little plant-based fiber-rich foods in our diet, contributing to cancer and heart disease and autoimmune disease. We're so sedentary. We're sitting in front of the television, watching one TV show after another. And the pandemic has kept us at home. We're isolated. Many depression has grown in this past year, where we're largely isolated. So, I mean, this is a difficult period. And I think now more than ever before, these principles of lifestyle medicine are important lessons for us, all of us, to introduce into our lives. Even in the setting of the pandemic, we've learned that those most likely to have severe outcomes if infected with SARS-CoV-2, or even regrettably pass from infection, are those that are living with a chronic disease. The CDC has told us that those of us who have a chronic disease, if you're infected with SARS-CoV-2, you're 6 times more likely to be hospitalized and 12 times more likely to die. again, these connections are incredibly important. And, you know, AJ, I added a preface to the book. We had turned in the final version of the book, and the publisher reached out to me and said, you know, we're in the midst of this pandemic. I think it would be appropriate for you to add a preface to the book to speak to it. And I did. And I hope that that preface resonates with readers, because we need to connect those dots. It's not just that we're living through this acute infectious contagion that's causing so much death and destruction across our country and across the globe, but also the connection of how it's affecting those of us living with a chronic disease, how it's putting us at greater risk of poor outcomes. We are a society that is poorly equipped to battle this acute infectious contagion because of the fact that we are living in a chronic disease epidemic and an obesity epidemic.
Yeah. Do you find that patients struggle more with one of the spokes more than others, or is it just an individual thing?
Yeah, well, I think that's a great question. It is an individual thing. I think that probably the hardest one, because, and I'm sure you're probably going to agree with me on this, is probably the food, because there's so much confusion about what a healthy diet looks like. And there's so many comparator diets out there that are prescribing different approaches, and it gets really confusing. Should we be counting calories? There's paleo, and there's so many varieties, but this has been commonplace for decades, right? Every decade there's a new set of diets and fad diets that further confuse us. And I think the bottom line is that we need to just walk away from all of that confusion, because honestly, a healthy diet is it's pretty simple. It's one that is primarily plants. And right, I mean, if you just want to start there, I mean, what could we do today to get you to eat a little bit more of plant? You don't have to make you don't have to turn your world upside down, but could you commit to increasing the amount of plant-based options on your plate? Could we start there? And I think that sometimes I'm criticized by that, but because, you know, some people are advocates of creating change overnight. And that works for some. So I've had patients come in and say, you know what, doc, I'm good. I'm going to be 100% plant-based tomorrow. They can go from one extreme to another, but that's the minority. And most patients need a process. They need a journey, and we need, and so my goal with that individual is to support their process, be respectful of their journey. This is not, you know, a quick foot race. This is a marathon for many people, and it's about introducing small changes over time. And I think also whenever we begin a dietary change, and I hate the term "I'm going on a diet," or there's a lot of negative connotation to that. So I like to ask patients to look at this as a very positive journey, like a new beginning. The steps that you're taking will favor not just the scale, because I think that's another thing that we focus on, the number on the scale. And it's not really so much about the number on the scale, right? It's really about, obviously the number on the scale is the side effect of introducing these wonderful good habits into our lives. But I almost want to pull away from the scale, and I want to focus on all the positivity, like how this wonderful shift in my dietary profile is going to serve my reduction, the likelihood that I'm going to reduce my risk of breast cancer or diabetes or heart disease, or that my level of fatigue has dissipated, and I feel so much more energized, and I feel so much more positive about my life and my ability to live a happy, healthy, and joyful existence, to achieve my dreams and aspirations. And I think that's what this idea of lifestyle medicine is. It's bigger than that. It's like we're pulling back and we're looking from a distant perspective, and acknowledging that what I'm asking individuals who are reading this book to introduce these changes into life. This is not something that we're doing for a month or a week or for 6 months, that these are lifestyle behaviors that we're implementing into our lives for the rest of our lives. And it's a journey, because when we start something new, it feels, uncomfortable and we're not really used to it. But as we continue to exercise that behavior and strengthen that behavior, it starts to become a norm for us. And over time, you'll see the mistakes that you make early on. And I think that's another thing that people say to me, oh, I was doing great, and then I had this bad day. And then we're so upset with ourselves and we lay a lot of blame. And I want us to sort of pull away from that bad habit, in that when you make a mistake or you make a choice that was less optimal, let's learn from that experience. Like, what went wrong in that moment, on that day? What could we learn from it? So moving forward, we correct course, and we're better prepared to address challenges in the future.
Do you think having been a patient made you more sensitive to what is needed in medicine?
No doubt, for sure, AJ. I think often that in retrospect, at one point in my life, I thought October 11th, 1995, that was the day I was diagnosed, was the worst day of my life. And today I can tell you it was the best day of my life, because it brought me so much, it changed the course of my life, right? I mean, it brought me this level of awareness and this passion and this need to really understand the true nidus of the disease state, and understand that, in fact, although multiple sclerosis and cancer and heart disease are really distinct diagnoses, that in large part, the root cause is very similar. It's this process of inflammation that stimulates and catalyzes disease. And suffering as a patient, at one point in my life, having to take 12 medications and dealing with all of those side effects, the difficulty of having to walk with a cane for several years in my life, or even wearing a diaper. Those were difficult moments as a young woman, having to deal with that, or being in a hospital bed and feeling very vulnerable. So these experiences certainly gave me a true understanding of the other side. And I think it led to being a more effective physician, a more inquisitive physician. Certainly, I think a more patient, appreciative individual. I mean, AJ, at one point in my life, I couldn't feel my legs. I was taking 12 medications. I was depressed. I lacked hope. There was little joy. And today, more than 25 years since that diagnosis, I take no medication. I'm active every day. I practice every day. Everything that I ask of patients in this book, everything that I write, I practice these behaviors every day of my life. And each day, and I always say, each day I'm looking to improve upon the last day. I'm always working to do a little bit better. I'm flawed just like everyone else is, but I do my best. And no doubt that my experience as a patient has led me to be, I think, a more effective physician, a more effective mother, a more effective wife. My perspective on life has changed dramatically, favorably, and I often thank my MS for bringing me to where I am today.
That's neat. That is so awesome. Yeah, guys, if you haven't seen Code Blue, check it out. It is a wonderful documentary. And they can, is it on Amazon now?
It is on Amazon. It's on Google Play. Just about, if you go to drstancic.com or codebluedoc.com, I always forget the platforms, but I think we're like on 6 or 7 platforms. So you probably have one of those platforms. Yeah. So yeah.
So what did you enjoy more, producing a documentary or writing a book?
I think writing the book was really, somebody asked me, what are you most proud of? And the first thing that came to mind was the book. And I think it's because the book is really like 100% me. It's very simple. It's very straightforward. It's an honest conversation between myself and the reader. And I hope it feels like almost intimate, like it's a conversation that I would have with a patient in my office. And it's very honest. I don't know everything, and I don't claim to. I share what the evidence shows us. And I know the wonderful thing about science and medicine is that what we know today may not be true tomorrow. So I think we have to always keep, and this is why every day when I wake up in the morning after I've done my prayer or meditation and I've run, I always sit down and I look at the most recently published literature. So I'm constantly abreast of what is new and try. And if you ever wake up and think you know everything, you are off, my friend. We're learning every day. So a lot of humility and understanding that science is never black and white, and that but for me the book has been really fun to write. I was blessed in that the invitation to write the book came through a wonderful man. His name is Randy Davila. He's the president of the publishing company called Hierophant. Randy has been wonderful to me. I was a new author, so this was all new to me, and he really supported me throughout the process, held my hand. And in the end, I'm really proud of the book because it really is me. It just reflects all of who I am as a person, as a physician, as a patient. And I really just wanted to make it as simple as possible, and honest and transparent.
Nice. Do you do any kind of telemedicine, or do people have to live in your state to see you?
Yeah, well, I did do telemedicine. I actually closed my practice. I don't know if I told you this, AJ, back in October to accept a new position that I started in late October, and I'm not quite ready yet to share that publicly, but it's a new position that I'm really excited about. And it has a lot to do with redefining healthcare and bringing this idea of lifestyle medicine to the masses. So I'm excited. I'll be sharing. Hopefully I can come back to you maybe sometime in the future so I can share that. But yes, I think as I said, there's a lot of movement towards this, making prevention really cool again, and bringing this to the forefront and empowering patients. And I think that the future in healthcare and the way we train doctors, and I know you talked to Dr. Truk, but it's not just changing healthcare and placing emphasis on prevention and lifestyle medicine. It's also about how we train our doctors, assuring that the foundation on which we build all else is this idea of prevention first. Lifestyle medicine should be the foundation of all medical schools and all healthcare professional schools. So I think that the way that the healthcare experience will be, healthcare will be experienced by the average individual in the near future is going to change in a really positive way. And I'm really excited to be part of that.
That's great. Well, I can't wait to hear more about it. A couple of questions because you're a doctor. Judy wants to know, what do you think of osteoporosis medication for somebody who's already whole food plant-based?
Well, again, medication, and that's really, it's difficult to answer without knowing the history or the comprehensive overview of the individual who's asking, but medication can be an important part of the mix. Just because we're whole food plant-based and we're living optimal lifestyles doesn't mean that medication can't be part of it. Ideally, whenever possible, we want to reduce our dependency on pharmaceuticals. Remember, every medication that we take could potentially have a side effect. So we have to weigh out the risk benefit of every medication or procedure or intervention that we introduce into our lives. So it's hard for me to say for the individual who's asking whether it should it be an option that they use for their personal health. It really has to be an honest conversation that you have with your physician, who can weigh out all the risks and benefits. And ultimately, the physician can only advise and support the patient on their personal decision as to what they decide to do.
Great. I think it was a podcast I was listening to. You were saying there's a high degree of burnout with physicians and even suicide. How can we make that better for them?
Yeah.
I would imagine even with COVID, especially those that are on the front lines, it's got to be really difficult.
I think there's so much. It's just even the way that we train physicians. We ask physicians to work 24-hour shifts. And remember, this is when I was diagnosed with multiple sclerosis. It happened in the middle of a 24-hour shift in the midst of a residency that kept me highly stressed. And I think about my own training, and things have improved since I went to medical school and completed my residency. But think about it. I was on call almost every 24 hours. I would work, 24, 36-hour shifts. I was eating a very poor diet because what did we consume? Whatever was at the vending machine in the hospital at 2, 3 o'clock in the morning. There's no time for exercise. We're highly stressed. We're not sleeping. That's like 4 of the spokes on the lifestyle medicine wheel, AJ. So the way that we train doctors is counterintuitive, right? It's actually misaligned with all of the principles of lifestyle medicine, the things that we know enjoy and lead to optimal health and well-being. So depression and even alcohol and substance abuse are a big problem in medical students and doctors. And yes, physicians. This is a remarkable statement. Physicians have one of the highest rates of any profession of suicide. And truly remarkable. Physicians, we are the representatives of health in our society, and yet we are suffering and don't know how to take care of ourselves. So I think that's another lesson that should be introduced in the medical school experience. Self-care. And I know that Dr. Trilk is working on that. Dr. Trilk said something to me when I visited her several years ago and we filmed for Code Blue. She says this to all her new medical students coming in. First thing she says to them when they walk through the door, first lecture is, "You are your first patient." And I think that's a beautiful thing. Absolutely. We have to know how to take care of ourselves. We have to be really good at that. And that's such an important responsibility because we are an example for our patients. And we know from literature that's been published that doctors who practice what they preach, who patients can actually witness them eating healthfully or exercising, or they're out in the community practicing these principles of lifestyle that are so important, patients are more likely to engage in that when they see their physician doing it. So it's an incredibly valuable lesson. And I do believe that the way that we're training medical students is also changing in a very favorable way.
Yeah, well, I think you're more likely to see doctors with those habits if they are a lifestyle medicine doctor.
Absolutely, absolutely. But the good news is that lifestyle medicine doctors are becoming more and more commonplace. And by the way, it doesn't mean that you have to be you can be a lifestyle medicine orthopedic surgeon. You could be a lifestyle medicine radiologist. You can be a physician of any of these subspecialties, but you practice and you engage in these principles of lifestyle medicine. And I think that's important because if you just have the, let's say, the internal medicine, lifestyle medicine doctor who's speaking to the importance and value of these principles of lifestyle medicine, and then the cardiologist isn't speaking to the principles of lifestyle medicine, or the endocrinologist, then that's when we have challenges and we have obstacles. We all need to be speaking to this again, ubiquitously and unanimously. All physicians should agree that these principles are important because the evidence is overwhelming. The peer-reviewed medical literature speaks to this overwhelmingly. So it is, I think, unethical for us not to speak to it clearly and decisively. And again, it's not to say that we're going to negate or not utilize all of the other aspects like pharmaceuticals and interventions, rather procedures, all very, very important. But if we are, for example, if you're a cardiologist that doesn't speak to the importance of dietary choice and all the other aspects, exercise and stress and sleep, and you're not familiar with the connections of how they play a role in producing or catalyzing heart disease, then I think that you're falling short, and that is regrettable, and it needs to be corrected.
I think people are asking if you know anything about the study that vegans have osteoporosis. I guess Dr. McDougall said it's irrelevant.
I'm not familiar with that study, so I wouldn't be able to comment on
Right.
it.
And then somebody's asking about something called gummies. I don't know what that is because I'm really not out there in the world to know all these young people phrases. Maybe
Yeah,
it's marijuana or something. I don't know.
yeah, I'm not familiar with gummies either. I'm sorry.
I mean, I know what gummy bears are, you know. So
Yeah, those I know, but I'm suspecting that the gummies that are being referred to here are something different.
hey, you know, I just wanted to not only congratulate you on the book, but it's so wonderful you had Dr. Dean Ornish write the foreword, and
Yeah.
many people consider him the father of lifestyle medicine.
Yes, what an honor. Thank you for reminding me. I really wanted to speak to that for a moment, so I appreciate your reminding me. What a wonderful gift. Dr. Ornish is somebody who I so deeply admire. And yes, he is the father of lifestyle medicine. I remember the very first ACLM that I went to, and I heard him speak and talk about the importance of epigenetics and the effects of lifestyle on disease outcomes. And I was just in awe of his presentation, and it really affected me in such a great way. And then to have him agree to write the foreword for the book was just such a gift. And
That is really exciting. So other than buy the book, which I've been posting the link all throughout the broadcast, how else can we support your work?
oh my goodness, well, I would love to. Certainly, Code Blue is the documentary that we produced, and I know we talked a lot about last time. I would love to share that film, because again, Code Blue is not only speaking to the importance of lifestyle medicine in the individual, but also placing emphasis on changing the way we train healthcare professionals, so that what we're talking about today and what you talk about with so many of your guests who are experts in this idea of lifestyle and preventive medicine, that it should be, again, something that is spoken to by every doctor across the country and beyond. We should all be talking about this because it is undeniably powerful.
Right. You know, it's interesting because like people think of lifestyle medicine as alternative medicine. Lifestyle medicine should be the default. Anything else should be alternative medicine.
Yeah, it's not alternative at all. It is the foundation of health and wellness. Remember, in medical school, what we learn is this idea of pathogenesis. We learn the disease state. What we don't learn in medical school is the mirror image or the opposite of pathogenesis, which is what we call salutogenesis. Salutogenesis is how do we maintain health and well-being? And salutogenesis is lifestyle medicine. We maintain health and well-being by optimizing every aspect of our lifestyle so that we age gracefully, so that AJ, when you're 102, 103, after having that bright, beautiful day with your family and friends, we go to bed, we pass peacefully and joyfully.
Well, that's what I want. So there may be a lot missing from medicine, but one thing medicine now has is you.
Thank you so much.
Thank you so much for being here. And really, I wish you every success with the book. And guys, I posted the link. I know a few of you said you already bought it. So this is a really good time to help her out when it's just coming out, because I believe it's already #1 in new release in certain categories. So we got to make it in a lot of more categories.
Thank you so much, AJ. I really appreciate it. And thank you to everyone who's stuck with us for this past hour.
Great. Well, thank you so much. Take care, everyone. And thanks for watching another episode of Chef AJ Live. Come back tomorrow. We have another wonderful physician, Dr. Reshma Shah. She's going to be with Brenda Davis, a registered dietitian, talking about their new book called Nourish. Thanks again, Dr. Stancic.
Thank
Bye-bye.
you. Bye-bye.